This week's edition of NJBI is Minding Your Business is brought to you in part by AT&T, helping family, friends, and neighbors connect in meaningful ways every day. By PSE&G, powering a future where people use less energy that's cleaner, safer, and delivered more reliably than ever. By New Jersey's community colleges, aligning education to build an innovative workforce. Find out how your business can benefit at njpathways.org. And by New Jersey Business Magazine, providing critical information needs for New Jersey's business community for more than 67 years.
Welcome to NJBI's Minding Your Business. I'm Bob Considine. Well, substance abuse impacts everyone from employers to workers and people from all walks of life. And with it often comes barriers to addiction care. But there are resources and there is hope for those with the condition. And here to discuss it all is the Director of Addiction Medicine for Emergency and Hospitalist Services at RWJBarnabas Health, Dr. Alexis LaPietra. Dr. Alexis, thank you so much for being here.
Thank you for having me.
All right, so before we get into this great topic, I'm really glad to hear you're here to talk about it. Let's just get into RWJBarnabas Health. Give me the high level mark on RWJBarnabas. Okay.
RWJBarnabas Health is the largest, most comprehensive academic healthcare system in the state, working in partnership with its communities to build and sustain a healthier New Jersey.
Right, it is enormous, the prominent role that RWJBarnabas has in the state of New Jersey. And we're also talking about the Institute of Prevention and Recovery, correct?
Yes.
What is that?
So the Institute for Prevention and Recovery has been part of RWJBarnabas Health for 30 years, providing substance use prevention programming, nicotine and tobacco treatment, and peer recovery support services, both inside the hospital and in the community.
Okay, very good. So when we talk substance use disorder, as I was saying at the start, what are we specifically talking about?
So substance use disorder is a treatable medical condition, and it's really defined by harm related to the continued use of substances.
Okay.
So really people cannot stop using these substances despite harm going on around them. And forever, really until recently, we looked at this as a moral failing.
Yeah.
Or a lack of willpower. You're
right.
continuing to use these substances. There's clearly harm. Folks know there's harm, but they can't stop.
Yeah.
But now we know it is really a neurobiologic disease. And what's amazing is it's treatable.
Right. Are there certain people or characteristics of people who are kind of predisposed to this?
Yes, there are folks who have genetic predispositions, but all of us are at risk. There are multiple variables that go in to the development. And we do know through all of the science and the research, there are genetic predispositions, multiple environmental factors, but really we're all at risk. So it's not based on socioeconomic status. It's not based on race. Everyone is at risk, and therefore the stigma against it is so ridiculous because it can affect everyone.
Yeah, we're definitely going to get into stigma today. This is a big part of the conversation. But I am curious about the importance of recognizing this as a medical condition for the rest of the world here. I mean, why is it important that it's known as that?
Well, number one is it is preventable. So we can intervene early when there are some warning signs, and we can prevent the progression of the medical condition. But because it is a medical condition, there are multiple ways for folks to get treatment. So if we look at it not as a moral failing, not as a lack in willpower, but look at the FDA-approved medication, the incredible supports that we can provide with peer recovery and counseling, these wraparound services, just like other medical conditions where there is treatment, there's exercise, there's other lifestyle modifications, that is substance use disorder as well. So we can't categorize it as this scary, unique, stigmatized thing. It is a medical condition. And with medicine and with support and with recovery, that person can live a fully productive life. And it's really the stigma that prevents folks from talking about it and asking for help, but help is there.
Yeah, and the stigma, I often wonder if it comes from people who just don't understand it as something that, you mentioned a moral failing or a lack of, lack of control or whatever. I mean, if people don't have an addiction, they might not understand that, and they're very dismissive of that. Is that part of the issue too?
It is. Addiction has been around as long as human beings have been around.
Right.
But until very, very recently, we could not understand how a human being would continue to do something that would cause harm.
Right.
So clearly something's broken,
Right.
something's not right.
Right.
But now with the science, we know so much more. But like anything, once we get the wheels rolling on a cultural statement or thought, it's really hard to pull it back.
Yeah.
So for the last 10, 20 years, we've recognized this is a medical condition. We're working against hundreds of years. We think back to the Civil War when there was an epidemic with morphine. I mean, there was very little science back then, and we just missed and thought those people just can't get their act together. So we're really working against a lot of cultural misinformation, and that's where the stigma is rooted.
Right.
And it's with education, empathy, awareness, and medical folks talking more about the fact that it's a medical condition. I think that will turn the tide.
Yeah, and that's why we're glad you're here. What are some of the current trends in terms of substances? What are some of the more bigger problems going on right now?
Sure. So one problem is fentanyl. It's the illicit opioid that's out there for folks who might be injecting or snorting an opioid. Extremely potent, very dangerous. Folks who are using it every single day, that is an opioid use disorder. But there are also folks who purchase something off the street. They don't believe it has opioids in it. But if there's a little bit of fentanyl in that, they can use that one time and overdose and die.
It's tragic.
It's very tragic. So we have accidental fentanyl overdose poisoning from one single use. And then we have folks that are using every single day, and there's a lot of consequences to using that high potency fentanyl. The other one I'll talk about briefly is xylazine. It's actually a veterinary tranquilizer.
Yeah, right. It's for animals, right?
Yes, that is now in the supply, and human beings are using it. There is a lot of withdrawal, a lot of terrible symptoms that we see in the hospital when they stop using it, and also these wounds that look scary and are complicated and require a lot of medical support. So between the fentanyl and the xylazine, the drug supply is getting scarier, and we really need to pay close attention medically and provide support for these folks.
Yeah, and not to go too much down a rabbit hole, but when you talked about fentanyl, like I had read that it affects your brain chemistry. So it's almost like a reward center of sorts for if you take that. So,
yes.
Yeah, so it's dangerous stuff.
So when you talk about the rewards, that's really how you develop the addiction. So any opioid, but fentanyl being really potent, it binds in the brain. Dopamine spikes, and dopamine spikes when you look at your phone, when you have some coffee, eat a good meal.
When I do this show.
There you go. Yes, you enjoy it. It's so pleasurable.
Bouncing off the chair.
So when we see dopamine and our brain loves dopamine, we start to want to see it more and more. But then things change, and a little protein turns on and starts to take over all the brain systems. That's why it's a medical problem, because your brain chemistry actually changes after repeated exposure to that opioid. And then it's really, really, really hard to stop.
What about naloxone? What are we dealing with here?
Naloxone is a life-saving medication that's really easy to administer, typically in the nose, that can reverse the respiratory depression we see with opioids. So if you take too many opioids, you stop breathing. That's a big problem. With naloxone, it swipes all of that opioid off that receptor and allows you to breathe again. So you literally can take someone who is at death's door, naloxone nasal spray, and you can reverse that death and wake that person up.
Wow. Is that something that people are addicted to as well?
No, naloxone is non-addictive, and it is utilized only for reversal of opioid overdose. And you can carry it, and I hope you will after this. Your friends, your family, everyone should carry naloxone, because addiction is ubiquitous now, and no one is without risk. Someone may require it on a street, in a mall. And if you have naloxone, that nasal spray completely changes that person's life and allows them to have another chance.
Incredible.
Yes.
So excuse maybe a dumb question, but what if they're not breathing and they can't breathe in the naloxone?
Sure. No dumb questions.
Okay.
The naloxone is a nasal spray, so it just lays onto the inside of the nose, and those blood vessels absorb it into the bloodstream. So you don't need to be breathing, it just needs to get the liquid into the nasal cavity. And once you do that, or even before you do that, we really want folks to call 911. You will not get in trouble. There is no issue with calling EMS to come and support, because if that naloxone does not work, and usually people need a little bit more support, you have your cavalry coming. But that intervention with naloxone can really change the outcome.
So Dr. Alexis, as we are a business show, I have a couple of business offshoot questions to what we're talking about. If you're an employer and you have an employee or a worker who's got a substance abuse issue, an addiction issue, how do you handle that? Like in terms of retaining that employee, isn't that become an issue sometimes?
Yes, and it's an issue because of misunderstanding and the decades and decades of stigma for this condition. So like all medical conditions, if someone is struggling, typically they need a period of time to recover. There's supports around them, there's understanding. We don't have that empathy when we look at substance use disorder because we don't consider it medical. So from an employer point of view, we want to ask that our employees are comfortable coming to us to disclose that they're struggling. They don't always have to disclose it is with substances, it is medical, but come to us early so we can get you the support and we can get you the treatment. Let's be transparent and let's understand that this does affect all of us. And we do want to retain folks that work within our organization. But we have to remember, again, like all medical things, there is some complexity, there is a recovery time. But if we put up this hard wall, there's this stigma, you can't come, it's bad, then things spiral. We lose good people and recovery is possible. And that's a sin to lose good folks in our workforce because we're not really up to date on the science of what this medical issue is.
I'll give you the converse on that. What about an employer who's actually having an addiction issue and they're worried about, how am I going to be seen by my workers? How is it going to impact my business? Not that they have to disclose everything, but that probably weighs on their mind as well.
Yeah, it is really a hard one. If we could all be very honest and all the successful folks in our country and our world stood up and could disclose, did you ever have an issue with substances? The majority would have tried substances, and there's a good portion that would have struggled with substances, but we're so quiet and we're so shameful about it. And we want to be honest. We want our leaders to be honest, but we are still really fighting against that stigma. So I would say from a leadership point of view, being brave, standing up, being transparent and honest raises so much awareness, creates empathy, allows folks to communicate more freely. But I do think transparency is an issue that we really should lean on for this condition, share the journey, and help folks appreciate it's treatable, it's medical, and recovery is absolutely possible.
So Dr. Alexis, I want to make sure we get this right. RWJBarnabas Health Institute for Prevention and Recovery, what services and supports are being provided?
So the Institute for Prevention and Recovery has a few arms. There is substance use prevention programming out in the community for youth, for awareness, education, parents, school teachers. How do we prevent substance use disorder? Then we have peer recovery support. So those folks are people in long-term recovery from substance use who are now certified to be in our hospitals 24/7. They go to the bedside of someone with substance use disorder and just sit with them and say, I know what you're going through. Let's just talk. It's something the physicians, providers, and nurses, they can't always do. They don't know what it's really like to be in that person's shoes. So the peer recovery model is incredible, and we are very, very lucky to have it. The other programming that IFPR does is nicotine and tobacco treatment programming, because we know, of course, the harms associated with nicotine and tobacco use. So IFPR really has quite a few pillars of prevention, recovery support, empathetic, wraparound services for people who are struggling, the nicotine, and then lastly, harm reduction. And that comes back to the naloxone. Using naloxone prevents overdose death, that reduces the harm associated with opioid use.
Yeah, in naloxone, just one more question as we go back to that is, if that comes in contact with somebody who shouldn't have it, is it harmful?
Absolutely not. So naloxone is very safe. It is only used to take opioids off the receptors in the brain. But if a child found it, sprayed it in their nose, there's nothing bad that is going to happen. When we talk about accidental ingestion in the general public, there's no downside. Again, not addictive, no harm. When used properly, it saves a life.
Okay. And in closing, Dr. Alexis, when you mentioned the peer recovery program, And I'm thinking about some of the stories that these people who are addicted hear from their peers. Can you describe how, this affects you, how this affects RWJBarnabas, and how it affects those peers to be able to maybe just change a life?
So in medicine, traditionally, for a long time, we have not been kind to folks with substance use disorder. People who are struggling, they don't come to the hospital. I mean, many of us are taught, if you're in trouble, you need help, call 911, go to the hospital. Right. They'll take care of you. When you have substance use disorder, we have not really been that welcoming. So folks are apprehensive to come.
Right.
With the peer recovery model, RWJBarnabas Health is educating its physicians, its providers, its nurses, its pharmacy. Everyone is understanding the role medicine plays in recovery. But really the foundation of that came from seeing peer recovery in action. So we see folks with substance use disorder at their worst. They're in the hospital, they're at their worst, they're sick. And then from a medical point of view, we're not sure if they ever really get better. But now we get to see someone living recovery.
Right.
And we say, oh my gosh, you look like my neighbor. You look like my kid. I didn't realize this was possible. So it changes the entire face of substance use disorder to know that I can help this person down the road of recovery, and look, they are living a really fulfilled life. So peer recovery has really culturally changed RWJBarnabas Health in its awareness of what a strong role it can play in collaboration, medicine, nurses, pharmacy, peers. Right. The whole thing, the secret sauce to really getting people the help that they need.
I think it's tremendous. And folks want to learn more, they can go to rwjbh.org/prevention and recovery. Dr. Alexis LaPietra, thank you so much for being here, and I appreciate all your words today.
Thank you. It's been a pleasure.
Okay. Be back right after these words.
Did you know LED light bulbs can use up to 90% less energy? And they often last up to 25 times longer than traditional incandescent bulbs? Plus, there are rebates for switching. Believe it. For more, connect at bizsaid.pseg.com, your trusted partner in energy efficiency.
Welcome back to NJBIA's Mind Your Business, as we bring you highlights from NJBIA's recently held Energy and Environmental Policy Conference, where PSE&G CEO Ralph LaRossa sat down with NJBIA CEO Michele Siekerka to discuss energy and our opportunities and challenges in the state of New Jersey. Have a look at this very intriguing conversation.
So as we said, the energy crisis is at the top of everyone's minds. We heard a lot about it, and as we know, the gubernatorial candidates are focused on it. In a recent public statement about surging energy prices, you stated that the current rules and regulations around energy generation and delivery are not capable of providing what the state needs, and that the state must take action. So I want to break that down. From the state perspective, can you explain the challenge in the rules and regulations as being headwinds toward providing the energy that the state needs today?
Yeah, so really what I was referring to in that conversation, and it's something we've been saying for a long time. I know there's a lot of folks that are out there saying, hey, how come PSE&G and the other companies in New Jersey didn't give enough of a heads up that this was coming? We've all been screaming about this for quite some time. And it really is the fact that there's just a lack of momentum to build new generation, right? So again, more than 80% of our business is that wire delivery business and pipes. And so we count on getting the electricity from someplace else and bringing it to the customers. Well, that entity that procures that power right now is PJM. PJM is the Regional Transmission Authority. It was put together several decades ago by Pennsylvania, New Jersey, and Maryland, and it was put in place to balance load. It wasn't put in place to have a market. About 20 years ago, it put in place a market function. And when it did that, it was at a time when there was surplus generation. So there wasn't a lot of attention paid at that point to what are we going to do to make generation show up in the future. There's a couple things, I won't go into into all the details, but there's a capacity market, there's an energy market, there's ancillary services, there's ways that generators get paid. And so what happens is, in that capacity section, they are intending to incent new generation to get built by sending a 3-year market signal that says, hey, listen, build new generation. Well, for those of you that have a business here, and I think most of you do, what does a 3-year price signal tell you? It tells you what you're going to get paid in 3 years, over the next 3 years. Well, if you don't build a power plant for 5 years, what clue do you have about what you're going to get paid in 5 years? So how do the board of directors of any company, whether it's a privately held company or a publicly held company, make a decision about building a new power plant when that's the market construct that exists? So as a result, what we've seen a big push on solar, because solar can come up and be online pretty quickly. We had the challenge with offshore wind, which, by the way, we were part of for a while. We as a company have, for the last 20 years, talked about an all of the above strategy, and so we've been doing that. We did some solar, we've done offshore wind. We got out of the gas generation business from an investor standpoint, and I can dive into that if you want. But that's what's being built right now. We haven't built a new power plant here since we did back in Sayreville over 10 years ago. So what has happened? We've put a lot of extension cords into Pennsylvania. And so any of the extra load that we're now servicing is coming from Pennsylvania. And it's a simple supply-demand equation, and there's not a market signal that's telling these the generators to come in and build. And that's not just here. They're not building in Pennsylvania. They're not building in a bunch of different places to the level that demand is coming up to. So it's a challenge for us, and this isn't going away anytime soon. You know, if people want a quick solution to this. It takes 5 years to get a turbine delivered now, at a minimum. 5 years for a turbine.
That's not even taking into consideration the supply chain challenges that we have today.
So we can argue about permits, and this is the challenge. You can't get a new turbine in this country in less than 5 years. We have to start solving this today.
And so you brought up PJM, and we heard a lot about PJM yesterday, and you said initially it wasn't supposed to be a market, but it's become a market, and because of that, the ability to compete becomes really challenging. Someone who's pushing energy into this state can't compete with the coal across the state, and therefore the emissions are higher, and the whole thing is a repetitive circle. How can a state, if a state can at all, influence that process?
So we've talked quite a bit. There's the opportunity for a state to make a procurement request specifically for that state. It's called an FRR. Again, it's an arcane regulatory process that we could go through. But it is a way for the state to take control. But it has to start with a plan, right? The way a plan is put together is a state needs to have an integrated resource plan. You would think, how many people think PSE&G designs the grid? And if anybody does, the answer is you're wrong. We have nothing to do with designing the grid. We provide input into what we think the load's going to be, but we don't design the grid. In fact, we haven't, in the state of New Jersey, created an integrated resource plan since the year 2000. We need to start with a plan, and we need to start now.
So I love the idea of strategic planning. My staff's probably rolling their eyes in the room. I like themes too, so we got have to come up with a great theme for this. We can't call it the integrated blah, blah, blah plan, right? It's got to have something sexy sounding, right? But to me, it sounds like you just need the right group of people in a room. Going to get really simple, right? Don't eat the elephant in one bite. The right people in the room, couple of whiteboards, somebody really good to facilitate the discussion, 5 questions, boom, and see what comes out of it. Good start?
It's a really good start. But it's getting everybody in the room, right, and having a conversation. It starts with those policy questions, though, right? And then once that happens, we get that good start that you talked about. I really think the state goes ahead. They figure out a way to procure some of that power that we need. There is a gap. You know, our back-of-the-envelope calculation says we're about 6,000 megawatts short. Maybe a little more, maybe a little bit less. But if we want to control our own destiny, especially around those 4 topics that I talked about, then you have to procure your own energy. Don't count on somebody else with an extension cord. Actually control your own destiny. Take control. So we can do that in that room after those 4 questions. Put the procurement out. Still fight with PJM. Try to get some rules right. Maybe they'll turn around. I think that's just that the governance, and I, again, talk for days about it. The governance model at PJM is broken. It has been. It's going to be really tough for them to recover. Maybe we need a new RTO. Maybe we don't need to be in an RTO. Maybe we just have a state set up, and we we do balancing across those are conversations we can have.
Maybe we have some regional discussion with the others in
Other
our
states that are
RTO
more
and have
aligned,
a regional
right?
strategy.
Right. There's
Another room, another whiteboard, another
It's
another
certainly
discussion.
something we can do, but it has to start here, right? So we get that going. And then, look, I think we should do something about the fourth reactor, or maybe a fifth reactor, because the plants have kind of gotten themselves strained out a little bit. We can't invest all that's needed in that power. It's going to cost the state, or it's going to cost somewhere between $20 and $40 billion. It's a round number, to say the least, 20 to 40 billion, but there's a lot of reasons for that, and again, we could talk for days about it. We're a $40 billion company. You can't bet a company on one project. So you got to go out and you got to come up with plans. Well, the federal government, if you believe what's going on at DOE, we might get 80% of the funding through a loan from DOE. That's a pretty good start. And then there's some other pieces of the puzzle that we're starting to explore some of that stuff to enable, not to invest, but to enable the state to have that solution at its fingertips if it wants.
So let's go back to affordability, because that's certainly something on the minds of the customer, and particularly for the business community with the spikes that just recently happened. You know, for a resident, it's traumatic enough to see their bill go up 80, 90, 100%, right, on just their home. Now multiply that times 10 or 20 for a business. Take a manufacturing facility, maybe times 100. You know, when we talk out there about state utilities and how they're limited in resolving the current crisis, et cetera, building generation, then we come back to, well, are they simply passing that cost off to the customers without any markup? Can you really explain, you know, the role that the utility plays? And you operate in a box.
Yeah, no, I fail miserably every time I try to explain this. I try to tell my dad, who is 86 and living in Toms River, that it's not our fault, and he doesn't believe me. Look, you're going to get a presentation later today, which I think is fantastic, about the breakout of the bill. The utilities in New Jersey were 39% of the bill in 2023. The utilities in New Jersey in 2026 are down to 37% of the bill. We have to do everything we can to keep prices down. There is no doubt about it. We have to look for efficiencies. We have to try to streamline operations. All those pieces of the puzzle are things that we have to do. Hold us accountable to do that, right? That's fine. But that's on 37% of the bill, right? What we need to do is to help, from a thought leadership standpoint, have a conversation about those 4 questions that need to be answered, and then let's go build something. Stop talking about it. We gotta actually get to work.
If you had one word of advice for the next governor, 8 days from now, what's it going to be?
Yes, let's roll up our sleeves and let's get to work. We cannot sit around. It's going to take 5+ years to build a gas plant. It's going to take 12+ years to build a nuclear plant. We've seen what happened with the wind industry if people want to use wind as one of the sources. Solar is not that easy to bring on either. There's a lot of challenges about, the utilities aren't ready. By the way, if anybody wants to check our backlog of our solar projects, we publish it on our website because we want the transparency, and we're blatantly sick of hearing that. So glad to have that information public, and you can go look at what our backlog is. But there are challenges for some of the other utilities, and the reason is that they were not built to service the load the way our utility was built. We had a lot of great engineers 50 years ago that built a system in a loop design. JCP&L, Atlantic City Electric, to some degree Orange and Rockland, they were radial designs. So when you have a line going out, just like your hose at your home, it might get a little bit less pressure when it gets to the end. And so vice versa, it's a little bit tough for those folks to get up to speed just as quick. So we need to do all of those things. It all depends on that emission profile and what else we have. So let's just get to work.
All right, thanks to PSE&G CEO Ralph LaRossa and NJBIA President and CEO Michele Siekerka for that great discussion. And thank you for joining us on NJBIA is Mind Your Business. We'll see you next time.
Did you know our energy efficiency advisors can help you apply for rebates and other valuable incentives on your next energy efficiency project? Believe it. For more, connect at bizsave.pseg.com, your trusted partner in energy efficiency.